Hi guys, and thank you for letting me do this journal club remotely. This article is the effect of antioxidants on male factor infertility, the males, antioxidants, and infertility, or MOXI, randomized clinical trial. The background for this article is that several of the things that we know are well associated with infertility have also been shown kind of in the wet lab to be associated with increased reactive oxygen species in semen. And the big ones that we think of are varicocele, GU infection, and smoking, all things that we counsel our patients on. Biology does suggest a possible role for reactive oxygen species in disrupting genetic and cellular replication, and this is kind of how we think it might occur, at least in the sperm production. And so this oxidative stress cascade shows that reactive oxygen species coming from any of those cells we mentioned activate the liberation of these polyunsaturated fatty acids. That leads to lipid peroxidation, leading to disruption of membranes, as well as production of more reactive oxygen species, this lipid aldehyde. This kind of feeds back in and causes the cycle to keep continuing. And the problem with this is that not only does it kind of impair the structure of the cellular membrane, but those reactive oxygen species also modify proteins that we know are involved in the sperm-egg interaction. And so it might be reasonable to think that if reactive oxygen species cause issues with fertility or at least alterations in our semen parameters, and antioxidants in general are known to decrease levels of reactive oxygen species in the body, we should try and think about prescribing those to our patients for these issues. And so they have been shown to decrease oxidative stress in semen in the wet lab, and in a couple studies to possibly improve semen parameters, most notably sperm motility and DNA fragmentation. And the antioxidants that have been studied are vitamin C, vitamin E, selenium, N-acetylcysteine, and carnitine. And the media really latched onto this. And so if you Google antioxidants and infertility, you get a ton of articles and videos telling you that they may be the cure to your fertility issues. The kind of strongest evidence that we had up until this article that we're discussing today was this Cochrane review titled Antioxidants for Male Subfertility. And their kind of big takeaway message is right here. It was that antioxidant supplementation taken by subfertile males may increase the chance of a live birth. However, the overall certainty of evidence was very low, from only 12 small to medium-sized RCTs. They also said we have low certainty evidence that clinical pregnancy rates may increase, but all in all, that more kind of studies are required for us to say this with any certainty. And so the purpose of this study, the males antioxidants and infertility study, was to test the hypothesis that antioxidants would improve male fertility without the use of assisted reproductive technologies. The way they did this is they performed an RCT at 9 clinical sites over the United States. They enrolled males and couples that had male factor infertility, and these were the kind of inclusion-exclusion criteria they used to gather that population. With regards to the couple had to definitionally have fertility issues, so have more than 12 months of trying without a successful pregnancy. They had to be heterosexual and cohabitating and doing the deed. Males had to be over 18. They had to have at least one abnormal semen parameter, while females had to be 18 to 40, evidence of normal ovarian reserve, at least one patent ovarian tube or fallopian tube, regular cycles, and evidence of ovulation. Basically, no glaring kind of female factor contributions. With regards to exclusion criteria, the male couldn't have had any previous sterilization procedures, or the female. And the couple couldn't be planning IVF for the next 6 months. Males also were exempted if they had a sperm concentration less than 5 million per mil, if they were using a medication that affected their reproductive function, if they were using multivitamins or herbals, current serious medical illnesses, currently on anticoagulation, had untreated hypothyroidism or uncontrolled diabetes. And then females in the couple were excluded if they had a history of moderate or severe endometriosis, a BMI over 35, a history of PCOS if they were currently pregnant, if they had any current serious medical illnesses or a history of pelvic radiation, radiotherapy, or chemotherapy, or current use of a med that would affect their reproductive function. They enrolled couples. They ultimately ended up with 171 couples entering the study, and they've split them into 2 groups, one being a placebo and the other with the male receiving an antioxidant formulation, which contained vitamin C, vitamin E, selenium, L-carnitine, zinc, folic acid, lycopene, and vitamin D. These couples then went into phase 1, where they received 3 months of therapy, either placebo or antioxidant. And then they had semen analysis and sperm fragmentation analyses done at day 0 at the start and at day 90, 3 months in. They also had blood samples analyzed for selenium, the multiple vitamin E forms, and zinc at day 0 and 1 month in. Phase 2, they then proceeded into, which was another 3 months of therapy. And in this phase 2, females underwent ovarian stimulation and IUI to see if there was any impact in pregnancy rates with assistive therapies. And this is kind of the crux of what they found. And so this is their table 3 in the paper. And what we're looking at here are the semen parameters listed here on our left side: sperm concentration, or morphology, motility, DNA fragmentation, total sperm count, and total motile sperm count. We're looking at the change from baseline to month 3. And our 2 columns here are the antioxidant group and the placebo group. So what they found is that there were 3 parameters that seemingly seemed to change with some statistical significance. The first of these was sperm concentration, where those in the antioxidant group actually saw a decrease in sperm concentration, whereas the placebo group saw a small increase, and the difference between these 2 was significant. The total sperm count kind of makes sense. They saw go down in the antioxidant group and increased in the placebo group, and the total motile sperm count similarly. So in general, weak differences between the 2 groups. If you look at these confidence intervals, there's actually a lot of overlap, and certainly not in the direction that we were kind of hoping to see, or at least was our hypothesis. They did try to break down these findings into a subgroup analysis. And so now what we're looking at are subgroups of gentlemen on the left side here. So individuals with sperm concentration less than or equal to 15 million per mil oligospermia, teratospermia or stenospermia, and those with high DNA fragmentation rates. And here what we're kind of focusing on is, again, the change of parameters, so the delta from time point 0 to the end of 3 months. And then the p-values here are significance between the antioxidant and the placebo group. And here, within these subgroups, those individuals with low sperm concentrations did not see any statistically significant increase in sperm concentration, or difference between the treatment and placebo group. Same going for morphology, motility, or DNA fragmentation rates. So no changes within the subgroup analyses here. Overall, 15% of couples in the antioxidant group went on to have a live birth in the kind of studied window, whereas 24% of couples with placebo had a live birth, but this was not statistically significant. And in that phase 2, whenever women received ovarian stimulation and timed IUI, pregnancy rates were 12% in the antioxidant group and 21% in the placebo group. And again, although this is not the directionality that we would expect, it wasn't actually statistically significant. So in general, no difference between the 2. At the end of the day, then, what they found is that male use of antioxidants did not improve semen parameters and did not improve pregnancy rates after 3 months. Importantly, we saw no improvement in motility for astenospermic men, and no improvement in DNA fragmentation rates for those gentlemen with high rates, which were kind of the 2 leading theories in how this might help, and the 2 ways that we've actually seen it working in the wet lab. All of this is to say that antioxidants may decrease reactive oxygen species in semen, but it does not necessarily translate into improved semen parameters in a clinical setting or improved fertility rates. The strength of the study was that it was a large study, it was multi-site, it was a randomized controlled trial, and they did study a large mix of antioxidants. And so one of the criticisms of the Cochrane review was that basically each of those prior studies had studied a different subset of antioxidants, and so it was hard to kind of join these findings together. The weaknesses was kind of related to that. There's a possibility that including this many antioxidants, the group of them could have somehow counteracted the effect of one or another. I think that's probably somewhat unlikely. They do have a concern that they could have incurred some form of selection bias, and they say that they may have seen a more positive finding if they included only men with documented elevated reactive oxygen species in the semen. But the reason they give for not doing this is because that's not kind of how antioxidants are currently being marketed. They're being marketed to anyone with infertility, and so they wanted it to be a more realistic study in that way. And then finally, realistically, they weren't adequately powered to determine the effect of antioxidants on live birth rates, but they were the largest well-designed trial to look at this to date. So that is kind of the pertinent, realistically negative findings of this study, and we'll give some time for discussion.